Bone health is something that is mostly talked about during childhood years because whilst we can maintain bone density after this point, the capacity at which we can improve it is limited. My name is Elle, specialist eating disorder and sports dietitian, and I'm going to discuss some of the factors that influence the health of our bones. Many of you watching this video will be into keeping fit by some form. We often take our movement for granted, and underneath our muscle and strength are our bones. Our bones support us and allow us to move and protect our vital organs, which is why we really want to take care of our bones. There are many forms of bone disease and ones which can affect us from an earlier age than we may realise. The most common one is osteoporosis, which is where our bones become weak and fragile and are more likely to break. This also means that the bones are harder to heal. It is normal to lose bone as we age, but if we do not protect our bones to the best of our ability, we can start to lose bone much earlier in life, and this can lead to bone diseases. So, let's look at what we can do to support our bone health. First up, and probably the most well-known, is calcium. Calcium is a mineral that is needed for promoting the health of our bones and teeth. Almost all of the calcium stored in our body is stored in our bones and our teeth, and this is what keeps them hard and strong. But we also require a small amount of calcium in our bloodstream for daily functions. If we don't get enough calcium through our diet, it is taken from our bones, which will hopefully be replaced at a later point, but if not, this can influence our bone density. Our bone density is a measure of the amount of minerals, particularly calcium, contained in a certain volume of bone. Throughout our life, we continue to replace old bone with new bone, and low bone density occurs when more old bone is reabsorbed than bone created, which can be caused by not having enough calcium to support the regeneration of bone and other daily functions within our body. Although calcium is found in many plant foods, dairy remains the best source of calcium. This is because calcium is not a very bioavailable nutrient in general. Bioavailability refers to how easily a nutrient can be absorbed. If a food label states that something has 300 milligrams of calcium per serving, you're probably only going to absorb about 100 milligrams of that. Things like tannins in tea and coffee and phytates found in many vegetables and whole grains can hinder the absorption of calcium into the bones because they bind to calcium and prevent the absorption of it. So not only is the quantity of calcium lower in plant foods, but it is also difficult to absorb as plant sources commonly contain phytates. It is recommended that we have 3 servings of dairy a day to support our calcium requirements, but some people may need a supplement too. Calcium requirements vary as we age and throughout different stages in our life. For children, it varies from 350 milligrams to 550 and increases again as adolescents to 800 to 1000 milligrams. Adults need about 700 milligrams per day, but requirements may vary in some cases. For example, someone with celiac disease will require higher amounts as their ability to absorb certain nutrients is reduced, or those who are pregnant will require more calcium as well. It is also recommended that those who are at risk of osteoporosis and other bone diseases, like individuals with hypothalamic amenorrhea or are menopausal, should take a supplement in addition to calcium within their diet. If you are vegan or don't eat much dairy, a calcium supplement may be recommended. Many dairy alternatives are fortified, but organic brands are not, so ensure that you take a look at the ones that you use regularly and ensure they're fortified. You can enhance the absorption of calcium by taking it alongside a vitamin D supplement. There are 2 forms of vitamin D, vitamin D2 and vitamin D3. Vitamin D is actually a hormone, and we can produce it within our body, but this will depend on how much daylight and sunshine we get. In the UK and Ireland, the sunlight is only strong enough to make adequate levels of vitamin D from April to September. We generate vitamin D3 in our body from vitamin D2, which we obtain from sunlight, but we can also get vitamin D3 from supplements as well. The Scientific Advisory Committee on Nutrition emphasized that calcium alone is not sufficient for bone health. Remember when I explained that calcium isn't a very bioavailable nutrient? Well, vitamin D can actually assist in the absorption of calcium. Vitamin D is a fat-soluble vitamin, meaning that it is mostly found in fat-containing foods like the yolk of the egg or in oily fish like salmon or sardines. Some foods are fortified with vitamin D as well, like breakfast cereals, yogurts, and milk. Vitamin D is a supplement that we should all be taking, and 10 micrograms is recommended for all adults and children, especially during autumn and winter months in the UK and Ireland. Myprotein have a calcium and vitamin D supplement in one, which is super convenient as it means you don't have to double up on supplements. Numerous studies have shown that weight-bearing exercise can help maintain bone mass and even promote growth. Activities which require increased use of our bones stimulate calcium absorption into the bones and promote bone formation. Strength and weight training put stress on our bones, which can stimulate this process. Although weight-bearing exercise promotes bone health, it is important to mention that over-exercising, under-fueling, and disturbances to the menstrual cycle will negatively impact bone health. So finding the balance is really important. Changes to the menstrual cycle or not having a period increases the risk of osteoporosis, especially if it is for a prolonged period of time. Women naturally have a higher risk of developing osteoporosis than men due to the hormonal changes that occur at both menarche, so when we start menstruating, and menopause. Estrogen is required to develop and maintain bone density, and a reduction in this hormone can increase the risk of fractures and osteoporosis. Many people don't realize that frequent dieting, restricting our intake, or maintaining a low body weight can have a negative impact on our bone health. Not eating enough calories and dieting negatively impacts bone health, as restricting the amount of food we're eating can limit the amount of calcium obtained through the diet. But equally, other consequences of dieting, such as loss of menstrual cycle, have negative effects on our health. Those who are underweight or those who have yo-yo dieted and had fluctuations in their weight often have a higher risk of fractures and bone diseases, which can affect them from any age. This is attributable to being undernourished and the hormonal effects of dieting, but also the fact that bone mineral density loss occurs with weight loss, but it does not return to pre-weight loss levels with weight regain, meaning that there is more pressure on our bones. So, as you can see, there is a lot that influence the health of our bones than just calcium, and it is more important for us to consider our bone health as adults than we may have ever known. As always, if you have any questions, please leave them in the comments below, and remember to like and subscribe to the Myprotein YouTube channel for more great evidence-based nutrition information.